All right, so if we make this technique a little bit more advanced for the hamstrings, what we can do is, I'm going to switch sides here just so it's easier to see. So we'll bring this leg down, this leg up. What you can do is be in a more aggressive stance yourself. So I'm in a standing position, and you can start to anchor in and then pin and stretch as you move through. So I can anchor at the bottom and then lengthen it out and through. Anchor at the bottom, lengthen out and through. And if you can use your body like this, it's not a bad way to get in there. Now, because she's quite flexible, I've done this with other people too, where you work from the opposite edge. The disadvantage of this, the advantage here is I can see her face and I can tell, I can tell if she's in pain or not. The disadvantage is I can't quite get as good as leverage on her like this. So for people who are more flexible, often what I'll do is I'll bring them up like this, and then you can, and if it's too much, at least let me know, because you're bent back right now. Same hand positions right here where my fingers, everything are going to the outside, but we can set up in this position and work our way right down. And how's that for pressure? Are you sure? Because I'm working, it is firm. But look at the biomechanical advantage I have. Number one, big strong muscles from my erectors are holding her back like this. Number two, gravity is my friend, so I can push down in this position, and you can get right onto that ischial tuberosity for the attachment of semitendinosus, membranosus, and biceps femoris in a biomechanically advantageous position right here. And even beyond that, you can go ahead and anchor in and then lengthen the person out. Anchor in. Yeah, you do have that issue. She's beating me in sprints, but that's okay. We can work through, and we can work through and anchor and work through like that. This is access to tissue that you normally wouldn't get. Now, a couple of other things, though. You have to realize this is a pretty advanced position right here, and you want to check in with your person multiple times to make sure they're okay with it, right? So number one, I'm not fully in between her legs, but I am kind of in that border area right here. Most of your body's off to the side, so everything's fine. But give those verbal check-ins to make sure that they're doing okay. In fact, you know what I'm going to do for this camera angle? I'm going to change it just a little bit because it's important that we actually see her face. Should it be just a little bit? Hi, everybody. Something like that. You'll be able to see everything I'm doing from there. All right. Okay, so you're set up like this, anchoring in. And again, try it out. It's just a nice position to actually control somebody. If it was jiu-jitsu, you would use this as a way to pass through the legs, or you could hook into knee bars and or something like that, all right? But you're gonna anchor in like this. So this is one of my go-to treatments right here, if they have flexibility. If they can't get past 90 degrees, that treatment is not gonna work for you, but for a lot of the athletes that I work with, they can get past there. I do treat a lot of jiu-jitsu guys as well, and having that flexibility does give you good advantage. And should you want to, you can develop that flexibility for people too, right? You can have them set up like this, you can anchor in, and you can just be pushing them back into those positions to give them that stretch. Do a muscle energy technique from here. You're using bigger, stronger muscles on yourself to make your job easier. Working smarter, not harder is what we're looking at here.